So the less the virus circulates, the less critical boosters are.
Infectious disease expert Shane Crotty at the La Jolla Institute for Immunology is one of the nation's leading researchers on COVID-19.
And also a paper from NIH grantees from La Jolla just came out. Okay, the studies that you quote from Crotty.
Dr. Anthony Fauci has cited his research during congressional hearings, and when it comes to booster shots, Crotty says drug makers like Moderna have already been developing and testing them.
And the booster shots did work, and they also had a variant booster shot, and that one worked too.
So booster shots will likely be available. The big question, though, when or if they'll be needed. Crotty says it comes down to two things. One, how long the immunity from the vaccines lasts, and two, the variants.
So several of these variants of concern are more worrisome than the original strain, and some of them escape immunity to some degree. So essentially the variants are tougher to stop than the original virus, and so the vaccine might not last as long.
Crotty says there's a 50-50 chance that booster shots will be recommended by the winter of this year, but they might not be for everyone right away.
That there's a risk assessment that says, okay, if you're over 65, you should get a booster immunization at this point. And if you're under 65, you can wait longer, maybe another year or something.
He says the best case scenario is that the vaccines last a couple of years, but we just don't know that yet.
Basically, we just need more time. We just don't have a clear historical reference point for saying, oh, here's how long immunity lasts after you've had an RNA vaccine. We're having to measure that and watch that every month as time goes by.
Booster shots could also depend on infection rates.
SARS-2 is not going to be eradicated. It's just it's too widespread and too easily spread from person to person.
San Diego County is nearly 3/4 of the way to its goal of herd immunity, but he says it's a key way to stop the virus, especially in internationally traveled areas like San Diego.
Herd immunity also isn't just this line that you suddenly cross, and nothing happens before it, and then everything happens as soon as you cross it. There's a progression there, and I think most people think we're in the range where herd immunity should be having an effect now, and it should just get better and better the more people you can get vaccinated.
Crotty says some areas will likely not get to herd immunity and in turn continue to see pockets of outbreaks. Matt Hoffman, KPBS News.